Welcome back to my channel. I'm going to look at the spleen acupuncture points, functions, location, and also the spleen channel's pathway, so we can put it all together in an easy way. Without further ado, let's do it. Hi, I'm Clara from Acupro Academy, and I create acupuncture and Chinese medicine content for practitioners and students, making it easy to grasp and fun to learn. If you found this of value, please give me a like or even subscribe so you don't miss out on any future video. And now, let's rock it. Looking at the spleen channel and its 21 points. Sometimes it can be confusing finding the right locations of all the points and the functions because they have so many similarities. Well, I'm going to look at all this today. Let's go. Okay, so we're going to start with the spleen channel pathway. But before we do, below this video, there are all the links that you need, resources to my website. So if you wanted to know a little bit more or review the TCM function as an organ system in TCM, found it all in my resource page in the link below. Okay, so let's talk about the spleen channel pathway. Before we do that, the spleen meridian or channel, depending on how you want to use the word, is going to have 21 points, and it is a foot meridian because it starts at the foot. Every meridian that either end at the foot or start at the foot is a foot meridian. It is a foot Tai Yin. Tai Yin means greater yin. The long Tai Yin is a hand meridian, hand Tai Yin meridian, and the spleen is a foot Tai Yin. So the long and the spleen have a really good relationship. They have the same name. And the reason is they have a really good connection for the fact that they are related to pathogens invasion as well, which it affects the spleen and the long. So now let's start by saying that also the spleen is very activated, this channel, 2 hours of the day between 9 a.m. and 11 a.m. This in the morning time is the best time to either use your physical body for exercise or your mental brain to do productive mental work. So because this is when our spleen is at its strongest. So this is when if someone doesn't have a lot of energy in the morning, that's a spleen issue. But this is your best productive time, so utilize it well. Okay? All right, so the spleen meridian starts at spleen 1, which is at the big toe. And what it does, it is going to go along the medial aspect of the foot, along the anterior aspect of the malleolus, and just on the medial aspect of the lower leg, towards the knee, to the thigh, and up towards the inner thigh, or where the hip flexor area is when we bend and flex our thigh. Now, we have spleen 1, 2, 3, 4, 5. Then we have 6 where all 3 meridians cross, spleen, liver, and kidney. We're going to talk about this today. 7, 8, 9 at the knee, 10 and 11 on the thighs. And then we have 12 and 13, which are going to be close to the femoral artery. So we'll talk about that. And then 14, 15 on the abdominal region. Then we're going to continue to 16, which is still in the abdominal region. And then we're going to go all the way to the top of where spleen 20 is. So this is 17, 18, 19, 20, which are all in intercostal spaces. And then we're going to go back down to 21 because 21 is going to be on the medial side of our body on the intercostal space 6 or 7. So we go back down. Now, the meridian has a branch that's going internally. All meridians have internal and external branch. External part is where all the points are. Internal part is where it's connected to what we're trying to connect it to, which often is its own organ and its yin-yang related organ. So for instance, this internal branch goes through the spleen and stomach. Sorry for my drawing. And then we'll go to the throat and finish at the root of the mouth. So at the root of the tongue and at the root of the mouth, because digestion starts at the mouth, and spleen and stomach are all related to digestive system in TCM. There's also a branch from the spleen organ that is going to go connect to the heart organ, where it meets the heart meridian. So the heart meridian will start at its own organ. Yes? So that is the pathway of the spleen channel. The spleen channel as a whole addresses the digestive system issue, of course. It also addresses issues of muscle or muscular system issue, because the spleen is related to muscle in the 5 element. And it addresses anything that has to do with the mind as well. So we are going to look at all this, and also the reproductive system. It's very much related to the reproductive system and water metabolism. So lots to talk about when it comes to the spleen meridian. So let's start all the points, location, and function. Let's go. Okay, let's look at the locations of spleen points. Spleen 1 is 0.1 soon from the base of the corner of the nail on the medial side, because liver 1 is going to be on the lateral side, right? They're very close to each other. They're both on the big toe. So that's where that's located. Spleen 2, on the other hand, is distal and inferior to the first metatarsal joints. You can see where it is on the side of the foot. And then spleen 3 is proximal and inferior to the first metatarsal phalangeal joint. So as you can see, they're both on each side, and often people have, excess skin there in the ball of the foot. So we could see it's on one side, and then spleen 3 is on the other side. Spleen 1 is a special point 2 times over. First, it's a Jingwao point. As a Jingwao point, we prick to bleed it specifically for abnormal uterine bleeding. This is really good for women that have had very, very heavy gushing, flooding menstruation. It'll slow the flooding down, because otherwise they could become anemic very easily. Of course, we always want to look for the root cause of the problem. It's also used for women that have been trickling or spotting for like 3 months to stop the spotting. Again, looking for the root cause is important, but this point is really good as an emergency point. Second, it's a ghost point. I love ghost points, and if you haven't seen my video all on the ghost points, check it out right here. Spleen 1 as a ghost point is really good to use for women and men and anybody that has body image issue and eats their feelings. So for people that have tendency to have bulimia, specifically because they feel bad about their body image, and then they start eating and binging. That's a really good point. Again, we want to look for the root cause and do a full treatment, but this point has to be part of it. I love spleen 1. And those two things are what we want to remember about spleen 1. Spleen 2 is also a special point. It's a yin spring point, and yin spring point usually have tendency to clear heat. So this is a spleen point that clears heat when there is gastric pain with inflammation or febrile disorders without sweating. Also, it can be used for diarrhea that is smelly because there's lots of excess heat. So there's not many points on the spleen meridian that can clear heat. Spleen 10 is one of them as well, but spleen 2 is great for that perspective. That's it. That's that. Spleen 3 is a great special point as well. 2 times over, just like spleen 1. It is a shoestring point, which, shoestring points are really good for anything happening to the earth, to the digestive system. And it's a yuan source point of the spleen, which makes it the best point when there is malabsorption, when there is issue of the spleen not being able to transform and transport. This is the function of the spleen that will be reflected in this point. So any digestive system disorders like malabsorption, like bloating, cravings, issue with loose stools, and anything that's happening to the spleen and diarrhea that due to digestive system not properly functioning, this is the point. Spleen 4, as you can see, is distal and inferior to the base of the first metatarsal bone. And it's often mistaken for kidney 2, which is below the navicular bone. So we have to be careful and not mix them up. And then spleen 5 is located distal and inferior to the medial malleolus. As you can see in here, it is literally very close to liver 4. So they're very close to each other. The liver are in green and the spleen points are in yellow. I just wanted to kind of show you that way you can see the difference. And I love spleen 4 because it's also a special point. First, it's a luo connecting point from the spleen to the stomach. So that makes it a great point to address digestive system issue that affects both the spleen and the stomach. So upper digestive tract with lower digestive tract. That's a good point for that. Also, it is the confluent point of the Chong vessel. The Chong vessel is called the sea of blood, so it's related to the blood and essence and reproductive system. So spleen 4 is really good when there is issue with the menstruation system, or the menstruation maybe being late, irregular, painful, doesn't matter. Any menstruation issue, spleen 4 is going to be really useful, as well as for breast milk issues like postpartum, post childbirth, specifically combined with PC6. So PC6 and spleen 4 together, which are all confluential points. PC6 is the confluent point of the yin wei vessel, and so together they're really good at balancing female reproductive hormones. The two together, fantastic. I really enjoy using spleen 5, and I think it's an underrated, underused point. All spleen points are going to address digestive system issue, but what makes spleen 5 different? First of all, it's a Jing River point. And as a Jing River point, it's one of the best spleen points to help when there is mental and physical fatigue. So for people that overthink, overwork, students that overstudy, this is a really good point for mental fatigue, but also physical fatigue. I love to use this point for that perspective. Also, for people that get anxiety and stutter, right? Remember how the spleen channel goes to the root of the mouth, root of the tongue, right? So for people that get really anxious and starts to stutter and they feel like they can't speak and the tongue feel like it's knotted almost, right? That is the best point. I love spleen 5 because it's definitely underrated. Spleen 6, as you can see, is 3 tsun above the medial malleolus at the edge of the tibia. Spleen 7 is 3 tsun above spleen 6 on the line between spleen 6 and spleen 9. And I want to remind us that the medial tsun measurement for the body is between the medial malleolus to the popliteal crease is 15. So we want to make sure we have the right distance, right? When it comes to spleen 9, it is going to be posterior and inferior to the medial condyle of the tibia. And spleen 8 is 3 tsun below spleen 9, on the same line between spleen 9 and spleen 6. So those are all the points on the leg. Okay, this is the big kahuna. This is the rock star of all spleen point, spleen 6. It's probably my second favorite point of all points because my favorite point is stomach 40, but spleen 6 is oh so close. I love spleen 6. First of all, it crosses 3 meridians. It crosses the liver, the spleen, and the kidney. This is what its name is, right? So it is the crossing point of those 3 meridians. Because of that, it is, or it can be used for anything regarding mental health, digestive health, and reproductive health. Those 3 things. Spleen 6, put it with every sauce. So that's what I love about spleen 6. On top of it, a lot of things that people don't know. Spleen 6 is the commander point of the hip and the pelvic floor. So anything happening in the pelvic floor, in the hips area, being musculoskeletal or internal, you have to use spleen 6. Now we know it's a counterindicated point during pregnancy. Right? So we want to be mindful of that, but we can actually add it up at the end when we want to help with labor. And if you want to know more about cervical ripening and labor induction and anything that has to do with pregnancy, check out my course up here. That is the complete TCM and pregnancy course that makes you understand and makes you feel safe to treat pregnant women if you feel like you're a little bit hesitant. So that's my bypass. Spleen 6 is an amazing point because it also nourishes blood, which not many points do that in TCM perspective. So I love that about spleen 6. And I love to use it as well when there is any reproductive, like I said, mental and digestive health issues. So it is a fantastic point, as you can see, rock star of all acupuncture points, spleen 6. Are you enjoying my graphics so far? Well, you can find them all in my Acupoint Made Easy, an illustrated guide to all acupuncture points, and so much more. The PDF version has a lot of video links. You can download it on your phone, your tablet, your computer, and have it at your fingertips at any time. It has a great table of contents. The hard copy ships all over the world if you're someone that loves to hold a book and really enjoy the colorful part of my graphics. You'll find them all exactly the same as the PDF in the hard copy book. The feedback has been amazing. As you can see here, so many people have just loved the book or the PDF or both. So what are you waiting for? Click the link below and get your copy today. Let's get back to what we're talking about today. Spleen 7 is probably not used that often because it's mostly a local point for lower leg numbness or any pain, but it can also be used for abdominal issues and borborygmi. And that's it. Easy. Done. I love Spleen 8. I use it all the time in clinical practice because it is the chi cleft point of the spleen, making it the best point for menstruation cramping. So great for dysmenorrhea, any menstruation pain. It is great to prevent, so we can put it prior to, but also during menstruation. Best point for that. Spleen 9 is a Chassi point. And as a Chassi point, like all Chassi points, they're all located either at the elbow or at the knee. They have a lot of chi, a lot of blood, and they're quite powerful. And Spleen 9 is the best point for any dampness, excess body fluid, anywhere in the body. So any swelling, edema, bloating, water retention for excess fluid, like excess saliva, excess nasal discharge or post-nasal drip, anything, candida, yeast, a lot of excess vaginal discharge, any excess dampness, you've got to put Spleen 9. Best points, hands down. I use it all the time. Spleen 10 is located directly above Spleen 9. We're going to take the tutsun of the patella. That's the length of the patella. And Spleen 10 is located tutsun directly above the superior medial angle of the patella. Often it's great to cup the knee and feel the bulge of the quadriceps femoris. This is how we found the point because it is going to be on the medial edge of the quads femoris. And that's how we found the point. Easy? All right. Here's another point that I love, Spleen 10. It's one of the best points to clear heat from the blood. So when there's blood heat, what happens? Usually there is a lot of excess abnormal bleeding. So it's great for metrorrhagia, like heavy bleeding, menstruation, any kind of heavy bleeding and abnormal bleeding that is due to blood heat. Remember that when there is abnormal bleeding, either it's a spleen not holding the blood within the blood vessel and the person is more fatigued and cold and more weak. With heat in the blood, the person's feeling hot, right? So that's a different story. So those are the only two ways there's abnormal bleeding. So Spleen 10 is the best point when there's heat in the blood, creating that abnormal bleeding. It's also used to reduce inflammation and cool the blood for rashes, for hives, for allergic reaction where the person turns red and there's lots of red patches. This is the best point. I've used this so many times in clinic and it works like magic. Within 10 minutes, the rashes, the allergic reaction comes down. So love Spleen 10. It's a fantastic point. Spleen 11 is going to be a little more tricky to locate. It is succeed directly above Spleen 10 on the quadriceps femoris, on the line between 10 and 12, which is harder to locate, and we're going to look at it right now. Spleen 11 is, again, not used that much, and it's mostly for local issue and local pain, but it can also be used for bed wetting and urine retention because it regulates the pathways of the water. Having said that, there are better points for that. Kidney points are better, like kidney 4 is really good. And when there is urine retention, also kidney 4 is really good for that. So, but that is a point we need to know anyway, right? Let's go. Spleen 12 and 13, I'm just going to talk about the location. I did not quite locate it on the body because they're not used that much, specifically Spleen 12 because it is considered a dangerous point. We have to watch for the femoral artery, which is right there. So, if you could use other points that are better and not dangerous, I think for me personally, that's probably the best option. But spleen 12 is located 3.5 tsun lateral to the midline and right at the level of the upper border of the pubic symphysis bone. Spleen 13 is located 4 tsun lateral to the midline and just 0.7 tsun above and lateral to spleen 12. So they're very close to each other. 0.7 tsun is really, really close, and it's kind of like in the diagonal. And they're all really close, both of them, to the femoral artery. So we have to be really mindful of that. And they are used mostly for inguinal hernia. And there's lots of points in TCM that are really powerful for hernia. So if those points feel uncomfortable and because of their location, then there are better points, like liver points that are very close, but not as worrisome, if that's how we're going to talk about it, right? So hopefully that helps. Let's continue. So spleen 14 is kind of funny. It's 1.3 tsun below spleen 15, 4 tsun lateral to the midline. 1.3 tsun, not very easy to locate, right? Spleen 15 is 4 tsun lateral to the midline. And as you can see, spleen 16 is 4 tsun lateral to the midline and 3 tsun directly above spleen 15. So those points are very easy to locate. I think they're all on the belly. Simple. And they all do the same thing. So let's look at that. Spleen 14 and 15 are going to be for digestive disorders, specifically the lower digestive tract, like diarrhea, constipation, bloating, abdominal pain. Easy, simple, they're basically local. That's what that is. Easy. Let's keep going. Spleen 16 is the same. Nothing much more to add. It's the same as 14 and 15. It's all for lower digestive tract issues. And so it is at the same level of the small intestine, physical small intestine. So any issue, pain in that area, or diarrhea or constipation or a lot of indigestion, that is the point to use. Although I would say there are better points that are in the stomach meridian that I would use over spleen 16, mostly probably stomach 21, and using the points like Ren 12 would be probably a better option. But if there's pain in that area, we can still use it. It's not useless. It's just, something that would not be the best point. That's how I go about it. So spleen 17, 18, 19, and 20 are all going to be located 6 tsun lateral to the midline, using the clavicle as your 8 tsun marker. And then they're all going to be in the intercostal space. So 17 is going to be on the 5th intercostal space, and 18 is going to be on the 4th, 19 on the 3rd, and 20 on the 2nd. That's pretty simple, easy, done all through the intercostal space. Spleen 17, 18, 19, and 20, I'm going to group them all because they are all really useful to address problem of the upper chest, like rib pain, coughing, chest pain area. This is what we're going to use. But having said that, spleen 18 is also really good when there is mastitis or lack of breast milk, specifically combined with stomach 18 and small intestine 1. Those are going to make a huge difference in either mastitis or lack of breast milk. So spleen 18 is the one that has a little bit more to it compared to all the four. Locating spleen 21 starts at the 10th rib, and then you work your way up to each intercostal space until you reach the 7th and the 6th. It is on the mid-axillary line, and it either is located on the 6th intercostal space or the 7th. The one that is the most tender would be the spleen 21 for that patient. So some patients, spleen 21 is located on the 6th intercostal space, and then for some on the 7th. The most tender is always the right spleen 21. So when you locate them, it's always starting from the 10th intercostal space and working your way up. That's the easiest way to locate spleen 21. Spleen 21. I love spleen 21. It is the major lual connecting point of the spleen. So this makes it a very powerful point, because if you remember, the lual collaterals are basically little, vessels that are going to go from one meridian to its yin-yang counterpart. For example, spleen 4 is the lower point that connects the spleen to the stomach, and stomach 40 is the lower connecting point that is going to connect stomach to the spleen, right? When it comes to spleen 21, it doesn't connect to another meridian, opposite meridian. It connects to the next layer, which is the muscular layer. So the major collateral of the spleen, which is spleen 21, connects to all the muscular region in the body, like a big spider web. It goes and has a bunch of vessels that connects to all the muscles in the body. Because of that, spleen 21 is the best point to have as a protocol for fibromyalgia or any kind of chronic muscular aches. This is hands down the best point. You can use it all the time and it works really, really well. So that's why I love this point. So the spleen channel has 21 acupuncture points, and if you review them quickly, spleen 1 is the ghost point, which is really good when there is bulimia or eating our feelings, right? That's a great point, and it's great for abnormal uterine bleeding to stop it. Spleen 2 just clears heat. We're going to bypass it. Spleen 3, best point when it comes to transforming function of the spleen. So for malabsorption, digestive issues, that's the best point, right? Spleen 4, it is all related to blood because it's a confluent point of the Chung vessel. So anything related to the menstruation, pregnancy, reproductive hormones, specifically for women, best point. Spleen 5, great point for overthinking, for mental fatigue, for worrying, and for those who are physically fatigued as well. It's underused, in my opinion. Spleen 6, of course, crosses 3 meridians, so addresses anything of the liver, the spleen, and the kidney. Great to calm the mind, for digestive issues, and for anything with the reproductive system. So powerful point. It's also the commander point of the hip. Let's not forget that. It also nourishes blood, which not many points do that, right? So that's always good to remind ourselves. Spleen 7 is used mostly locally. Spleen 8, best point for menstruation cramp or dysmenorrhea, painful menstruation, because it is the Shikla point of the spleen. Spleen 9, best point for dampness, any excess body fluid in the body. Spleen 9 it is. Spleen 10, clears heat from the blood, so great for rashes, allergic reaction, as long as there's heat, or overbleeding, abnormal excess bleeding, as long as there's excess heat. Spleen 11, locally. Spleen 12 and 13, more for inguinal hernia. Spleen 14, 15, and 16, lower digestive tract issue. 17, 18, 19, 20, all for anything that's happening in the chest, like cough and rib pain, except 18, which is good for mastitis and lack of breast milk. Spleen 21, best point for any muscle ache like fibromyalgia in the body. Fantastic, because it's the major dual connecting point. Wow! We went and reviewed this in less than 2 minutes. This is how easy it is when you just focus on the most important function of each of the points. And that's how we use them in clinical practice. So I hope that was a great, useful information, and I'm here to support you. So any question, put them in the comment. I'm here for you, and there's so much more on my website. I have tons of resources on my website, which you can see in the corner up there. Lots of resources there. So make sure you take advantage, because I'm here for you, to support you. I'm Clara, and it was a pleasure for you to come to my channel again. I hope you enjoyed the content today and found a lot of value into it. Please subscribe so you do not miss out on any future videos, and watch those two here to have more content for you to enjoy and absorb. Have a fantastic day, and no matter what, keep rocking it using TCM.